Good morning. November 14th is World Diabetes Day. Every year on 14th November, the birthday of Sir Frederick Banting, who co-discovered insulin along with Charles Best in 1922, is celebrated as World Diabetic Day, and the theme of this year is access to diabetic care. See, diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin that it produces. See, insulin is a hormone that regulates blood sugar. Hyperglycemia or raised blood sugar is a common effect of the uncontrolled diabetes, and over time, it leads to serious damages to many of the body systems, especially the nerves and the blood vessels. Now, coming to types of diabetes, it is type 1, type 2, and gestational diabetes. Type 1 diabetes, previously known as insulin dependent juvenile or childhood onset diabetes, is characterized by a deficient insulin production and requires daily administration of insulin. Symptoms actually include excessive urine, that is polyuria, thirst, constant hunger, weight loss, vision changes, and fatigue. These symptoms may occur suddenly. Whereas in the type 2 diabetes, formerly known as the non-insulin dependent or adult onset, results from the body's ineffective use of insulin. More than around 95% of the people with diabetes have type 2 diabetes. This type of diabetes is largely the result of excessive body weight and lack of physical activity. Symptoms may be similar to those of type 1 diabetes, but are often less marked. So, as a result of this, the disease may be diagnosed several years after onset, after complications have already arisen, I would say. Usually, the risk factors are obesity, unhealthy eating habits, family history, and lack of exercise. Until recently, this type of diabetes have seen only in adults, but it is now seen in children too. Now, ways to lower the risk of this is like by changing your eating habits, proper exercise, drink a lot of water, etc. 80% of the diabetes is preventable. Simple lifestyle measures have been shown to be effective in preventing or delaying the onset of type 2 diabetes and its complications. See, people can achieve this by maintaining a healthy body weight, by being physically active, either 30 minutes of regular exercise, moderate intensity activity, etc. And they can be leading a better life, like eat a healthy diet, avoid sugar and saturated fat, avoid tobacco. Smoking actually increases the risk of diabetes and cardiovascular diseases, and they have to lower their cholesterol levels. And apart from all these, early diagnosis and lifestyle changes is very important. So now, coming to the health impact, over time diabetes can change the heart, blood vessels, eyes, kidneys, and can damage the heart, blood vessels, eyes, kidneys, and nerves. Adults with diabetes have 2 to 3 fold increased risk of heart attacks and strokes. Combined with reduced blood flow, neuropathy, or nerve damage in the feet increases the chance of foot ulcers, then infection, and eventual limb amputation, etc. Diabetic retinopathy is another case where it leads to blindness and occurs as a result of long-term diabetes due to the damage of the blood vessels in the retina. And there is also cases where there is kidney failure. Remember, every 20 seconds a limb is lost as a result of diabetes, so it is as bad as that. So, and now another one more thing that I would like to focus is like impaired glucose tolerance and impaired fasting glycemia, that is IGT and IGF, are intermediate conditions in the transition between normal to diabetes stage. People with IGT and IGF are at high risk of progressing to type 2 diabetes. So diabetes should be actually identified at the earliest to manage it effectively. So when you come into the pre-diabetic stage, start watching out, take care. That would be the best thing that we can do. You have to control your blood glucose, blood pressure levels, your food care if you're already diabetic, and other means are like screening and treatment of retinopathy. Your blood lipid profile should be under control. Screening of kidney diseases and treatments like that can be also taken care. And when you actually need to understand, once you know about this, you actually need to understand the hyper and hypoglycemia symptoms and react immediately to prevent and manage diabetes. So with this, I think together we can stop diabetes. And thank you for the patient hearing. Myself, Sweetie Rajiv from Hale and Hearty, wishing you a very healthy future.